can we please grab our seats? For fantastic earlier sessions and just as fantastic coming up. Huge privilege to introduce this next session, but before doing it, I'd just like to express my gratitude and admiration to a young man that I met a long time ago. He was actually sitting in an audience just like you were, listening to a conference that Tom Hunter was running, and it was in the Armadillo. And I think before the Armadillo, when the previous National Exhibition Centre was there, and he came up to me and said, "Frankly, I enjoyed that. Would you come and help me from time to time with my business? I've only got a few optical outlets, and so I'm very small, but I'd like to be big." And that was David Mollesdale. And we've had a personal friendship ever since. He's the man who owns this building. And he gave us this building today. You see how professionally everybody's looked after us. He gave us that as a gift for today. And the refreshments as well. So we didn't have that. I know, being Scottish, of course, I know we don't like to dig into our pockets too often. But David's a wonderful man. What he does, what Optical Express does for charity, all around the David Mollesdale Foundation, the clinical excellence, because he was, I think, for #1 in the world at one point for refractive surgery, laser eye surgery, and still remains up at the very top end in the world, the best in the world. So if you get your eyes done here or anywhere, one of the Optical Express clinics, you've got the best in the world looking after you. So again, my thanks to him for that for today, and my thanks also to some of the Optical Express staff who have come to join us. And special thanks to my next two guests. And we're going to run this next session a little bit like a fireside chat, talking about the eyes and eye health. I don't know if you know much about eye health, but I didn't know very much about it. I learned a lot when David said to me, "Frankly, you've got 2 pairs of glasses, son, one for distance and one for reading. Would you not like to have your lenses replaced?" Which sounded to be a terrifying thing, but I came to this very building, 7.5 minutes one eye, 7.5 minutes the other eye, walked to my hotel with goggles on because we didn't want any dark going in, but I could see perfectly. And even now, I can see you perfectly, and I can read without glasses. So it's a thought, folks. All of our eyes go in that direction at some point. But I have to say, eye health is paramount in our lives. You've got to be able to see where we're going, right? And that's what these two gentlemen are about today. Stephen Hannan is the Group Clinical Services Director. He's been an optometrist himself, 25 years, involved in healthcare ophthalmology. In fact, Optical Express has done more research on ophthalmology than any other eye organisation on the planet. They are very well ahead of the game, and Stephen is very well equipped to discuss healthcare, eye care, and optical and performance excellence here today. Also joining us is Colin, who is the clinical, again at the higher end of things here as a clinical director. So we've got 2 world experts here, and we're going to talk to you about the importance of eye healthcare. So, ladies and gentlemen, welcome to the Optical.
So, good morning, and thank you for joining this session on eye health and elite performance. First of all, David Mollesdale sends his apologies for being unavailable. Frank has introduced Dr. Stephen Hannan, our Group Clinical Services Director, and Frank himself, of course, needs no introduction. Former Director of Coaching for UK Athletics, current President of the European Athletics Coaches Association, Chair of the World Athletics Global Athletics Coaches Academy. No, don't be modest. It's over 5 decades of global sports leadership experience, serving as a coach developer, mentor, strategist, and motivational speaker. So, Dr. Stephen Hannan and Professor Frank Dick. Stephen, could you start us off by giving us the background and introduction to the Optical Express Group.
Yeah, no problem. Thanks, Bob. So Optical Express are a provider of vision correction services, eye health services across Europe. We have clinics, we have over 130 clinics across Europe. We're in Croatia and Germany, here in the UK and in Southern Ireland. And we specialise in a whole host of different eye services to include laser eye surgery and intraocular lens treatments for cataract and presbyopia correction. We have delivered as a group over 2 million surgical procedures since 2002. We've delivered over 2 million surgical procedures, and we've declined to treat over 1 million patients through our conservative and in line with our conservative suitability guidelines. Not every patient we see is suited to a vision correction procedure. We make a full and thorough assessment of the patient and their needs, their demands, their requirements, and we make a recommendation as a follow-on to that. Frank touched on a key point of the group, a key pillar of the group really is our philanthropic initiatives. As a group, we have donated over £36 million to good causes, charitable events across the group, which is now led by the Molesdale Foundation. There's a fantastic museum, maybe 5 miles from here in Bishopbriggs in the outskirts of Glasgow, with lots of fantastic events.
Yeah, just to mention that museum, I know quite a few of you are pretty well into cars and motorbikes and so on. I promise you, this is the best museum in the country for classic motorcycles and really brilliant range of cars from around the world. But the very top end, your Lamborghinis, Mercedes, and so on, they're all in there. And if you have enough time, folks, definitely worth a visit, because that's one of the centres for the foundation.
Yeah, totally. And it's the number one, it's the highest volume of Ducati motorcycles, for example, outside Ducati itself. So it's fantastic event, fantastic facility. Colin, you're into cars and you've got some personal favourites there, I think.
I do, absolutely. Amongst the Ferraris and the Lamborghinis and the Aston Martins, there's a Peugeot 205 GTI. But it was Stirling Moss's Peugeot 205 GTI that he daily drove. So there are cars that are very special in that regard. There are a lot of World Rally Championship cars there, and we even have a Spitfire.
Yeah,
and we've also got the car that was used in the Great Train Robbery.
I was trying to keep it positive. So, Stephen, I wondered if you could tell us a bit about what does an eye examination detect and why is that important?
Yeah, okay. So the eye examination really is something that we advise as clinicians. We advise that every member of the public undergoes on a routine, regular basis. So in the case of an elite athlete, my recommendation, I've personally cared for a number of elite athletes at the top of their game, and I advise them at least to have an eye examination at least once every year to check upon their eye health first of all. So if we think of the eye examination, basically what we are doing during an eye examination, after gathering a lot of health and general well-being information through discussion, we're assessing the eye health. So if you think of the eye as taking a step back, the eye is really the window to the body. What we can see within the eye is the cardiovascular system. So we can see through looking into the eye, the cardiovascular system, the veins, the arteries. We get an idea of the cardiovascular performance throughout the body through the eye examination. So with eye examinations, we can detect a number of different eye health conditions such as cataract, glaucoma, age-related macular degeneration, raised intraocular pressure, are all conditions that can be detected during an eye examination, out with the routine, what I would consider the routine checks of assessing a patient's vision and eye prescription for long-sightedness, short-sightedness, or astigmatism that can impact the general member of the public as well as the elite athlete and what they do. But back to eye health, we can also focus on general health conditions. During an eye examination, we can collect data, we can detect, we can diagnose the presence of conditions like diabetes, rheumatoid arthritis, dementia, whole host of different conditions, tumours, can all be detected through an eye examination. So it's really important for me that we make the point that an eye examination is something that is really a pillar of eye health, a pillar of general health. It's important that on a regular basis, at least once per year, that an elite athlete should have a vision correction assessment, an eye health assessment, an eye examination performed by an optometrist or eye doctor, who they go to on a regular basis, who gives them the care and advice that's certainly required.
So, just from everybody's point of view, I wasn't aware of just how important eye health was for elite performance.
Yeah, absolutely. Eye health, you know, if you think of the eye itself, well, if you take an issue like, and I guess in your world of elite sports, lots of events now will take place in different lighting conditions, perhaps at night, for example. You know, one of the factors that can influence performance is the adaptation to glare and halo, for example, of the athlete. And one of the key factors that can influence that is a condition called dry eye. Dry eye is basically a condition where the tear layer, there's a tear layer, a lake, if you like, a river, a lake that sits on top of the outer window of the eye. If that breaks up quickly, it's called a condition dry eye, which is basically where the tears aren't being produced in the way we want them to be, and they're not lasting as long as we need them to do, which results in symptoms such as quality of vision symptoms, glare and halo. So by improving these factors, Frank, you can actually improve the performance, you can improve you can reduce the likelihood of glare and halo causing an impact to the athlete.
Okay, so bring us really up to date on the world that we're in and the world that young people are in, sitting in front of screens all the time. Does that stop them blinking?
That absolutely stops them blinking. So what we see, and we see this with the younger generations, the Generation Zs and the generations before, is that what we are now in a world of, we're now in a world where near vision is so important to us. If we go back 20 years, the dominant area of vision correction was far vision. The dominant area of vision correction was for to enable people, the general public, to drive, perform day-to-day activities. Today, near vision is more important. Intermediate and near vision is more important. Intermediate vision, what I refer to as intermediate vision, is circa 65 to 70 centimetres. What I refer to as near vision is 35 to 40 centimetres. That level of vision today is far more important. What we know from statistics is that above the age of 55, north of 90% of the 95% actually latest stats of the public have a smartphone, use a smartphone on a regular basis. What we know through generations, and this is a post-COVID effect, is that the near vision demands on the younger generations is significantly greater. So the near vision demands on the sub 30-year-old individual is significantly greater than what it was 10 years ago. And that impacts the eye health, that impacts the tear quality. There's other factors that can influence tear quality, such as environmental factors, out with the ability to look at near. When someone's looking near, as Frank touched on, they blink less, and if you blink less, your eyes become drier. So it's important that that's assessed. Additionally, we tend to live our lives more now indoors. Living more indoors means that the air circulating is different, which means that again we blink less. So a lot of our environmental factors contribute to our eye vision and eye comfort, and that can influence areas such as sport.
I don't know if you felt the draft there, but everybody was blinking
fast. Yeah, exactly.
The draft up front. So again, coming to the practical side, I mean, it seems to me that if there is a question in your eyesight, spatial judgment begins to be an issue.
Yeah, absolutely. So if you think of spatial judgment, you know, one key area that I would assess as a clinician is the individual's stereo acuity. So how well do both eyes work together, which is a key fundamental of spatial judgment with your positioning and your posture. It's really how well do your eyes work together, how well can you judge distance is what we're assessing through that. So within an eye examination, we do lots of what I would call primary tests, such as checking your vision, assessing your eye prescription. Are you long-sighted? Are you short-sighted? Do you have astigmatism? What is the eye health? And then there's secondary tests, such as where we look at stereo acuity, we look at dynamic acuity, we look at peripheral acuity, and a lot of the secondary tests that we mentioned there can influence the athlete's performance.
So what can you do if somebody's peripheral vision is not good, you're going to be in big trouble in
Yeah.
contact sports,
Yeah.
for example.
So for example, in that you can do it. So the first thing you want to look at is why. You've got to get to the bottom of why as a clinician that peripheral vision is reduced. Is it due to, for example, an uncorrected eye prescription? It can be as simple as many of the public, and I've seen this personally in elite athletes, where the individual actually has a vision correction need that's not corrected, and when we correct that, their performance improves, whether it be their dynamic acuity or their peripheral acuity. So the base, we go with the basics first of assessing, is there a need for vision correction? How do we correct that? How do we give the person optimal vision that allows them to optimally perform from a visual perspective? We can then look at a range of exercises. Again, the dry eye element can contribute to peripheral vision. So we basically ascertain causes and treat those causes accordingly.
Okay, so just linking with the idea of spatial judgment, some of my colleagues might be thinking, well, I'm a coach to middle distance or whatever, that's got nothing to do with me. But does it have something to do with judging where people are?
Absolutely.
And for example, in long jump, making sure that you're adjusting.
Absolutely. And I guess also that what's important, I guess, in that phrase, Frank, is to ascertain how can we make those incremental gains, how can we make those incremental improvements? Are there functions out with the posture, the positioning of the athlete, that actually is there difficulties that athlete has that we can overcome? And one of the key ways to do that is to look at one's vision, and is there a way to improve, which leads to an improvement in performance.
Well, I remember some time ago when I was doing some stuff for rugby, they brought a lady across from South Africa, I can't remember her name for the life of me, but she was about eye gymnastics.
Yeah. So there's basically lots of eye tests, and there's lots of eye exercises that can be done. So for example, an individual who's got a reduced binocular status may do exercises such as even as simple as a pen, bringing the pen to their nose. Okay, and what that's doing is training the eye to come in and go back out. And through doing that, what you're doing is taking the strain off the visual system. You're improving the functionality of the information that's processed through the eye to the brain in nanoseconds that allows the individual to really perform a little bit better. So there can be exercises such as pen to nose, or there can be exercises where there's a string and a pen on the string that allows you to improve the convergence and divergence of the eyes, that improves the stereo acuity of the individual.
So cool. I mean, I think one of the things that occurred to me when I was working with interactive sport was that I know it sounds like one of my stupidest throwaway lines, but being focused is not the same thing as being blinkered. Right? Being focused is not the same thing as being blinkered. In the services, they talk about having tunnel vision and full vision. And you want to go in and come out again. But in our world, which is very middle distance and so on, it is seriously interactive, because we're trying to make sure that we know where everybody is when we're out there running. How can that be trained? Is that part of the gymnastics?
That's part of the gymnastics, right? That's part of the visual training is key, and really having that regular, essentially an eye coach who's guiding, measuring, realigning the training plan of that individual. Like you have in lots of ways, really routine is key when it comes to eye care. It's absolutely important that when exercises are given, that they're followed. They're followed, repeat. It's really, really important with eye healthcare, so that we ensure that we make those marginal improvements. Those improvements don't come overnight, they're not simple, but through a range of exercises, we can certainly improve the eye muscles.
Well, I think whilst we're talking about the very physical aspects of using our eyes and so on, if we can just broaden that just slightly, and I hope you can join in on this part, is that in business, in our lives, we've got to be as aware of this being focused, not being the same thing as being blinkered. If you're not careful in life, you can miss what's going on around about you. You know, you can be so determined to get your job done and so on, you miss what's happening out there. And just to give you an example, Nokia. Anybody remember Nokia? Yeah. It was the only phone we should have, Derek, right? No. Anything else was less than that. Motorola. It's just about 3 years ago now, and I remember the chief executive winding up the company.
Yeah.
One of the biggest brands ever, and his line was, you know, you did nothing wrong. and somehow we're lost. And a big message for all of us, this peripheral vision and stuff is also an attitude thing in life, to be able to make sure that you see what's happening round about you. Some of it's important, some of it's not important, but we've got to learn through experience to make sure that we make that kind of differentiation. Does that make sense?
Absolutely, that makes sense. And with eye care, the simple changes in vision and vision correction can make a massive improvement in how we perform our life. Our near vision, as we chatted on, is more and more important. It's ultimately essential now that really we have optimal vision at different distances, whether that be far, intermediate and near. So 80% of all symptoms, peripheral vision, glare halos, etc., are really related to that primary eye prescription, if there is one there, that we can overcome. So a lot of the symptoms an individual can have, peripheral vision difficulties, stereo acuity differences, night vision differences, can really be overcome through correction of the prescription, if there is indeed one there.
Stephen, in your expert opinion, does the athlete then benefit from laser eye surgery?
Well, laser eye surgery, as we touched on, is one of the options which is available for vision correction. Vision correction, traditional vision correction, is really in the form of glasses and contact lenses. And for many sports, that perform in many sports, glasses are not a suitable option for vision correction due to the inherent risks of the eye being knocked, the glasses being damaged, etc. Contact lenses similarly have advantage and have disadvantage. Laser eye surgery has a lot of advantages to the athlete, and what we see at Optical Express is a number of athletes come to us who wish to exit from the glasses and contact lens world. They wish to overcome some difficulties. I remember actually an international rugby player who talked to me about the reason he wanted to have eye surgery was he was wearing contact lenses regularly, and what was happening during international rugby matches, the contact lens was coming out, and he said he got to the point 5-6 times a match the contact lens was coming out because of the sheer cut and thrust of his exertion in that environment. So we treated that individual with laser eye surgery. He noted the benefit. I think what we see with laser eye surgery, what that is for everyone's benefit, is where we are reshaping the outer window of the eye, which is known as the cornea. We're reshaping that to focus the light on the retina, which is the sensitive layer at the back of the eye that connects the eye to the brain. And what laser eye surgery is a procedure that takes approximately anywhere between 20 seconds and 2 minutes of being applied to the eye, that reshapes and corrects permanently that tissue on the window of the eye, the cornea, that corrects therefore long-sightedness, short-sightedness, or astigmatism. So yeah, it's a very good option for athletes to really get that actually has a really short recovery time, which is one of the key factors, because one of the factors when an athlete has approached us is the recovery time. That what is it going to mean to their training schedule? Recovery time after laser eye surgery is hours or days, not weeks or months.
I found that. I mean, I had my eyes done here, both eyes, and I was staying overnight in the hotel up there because just to get a quick check the next morning, and perfect vision straight away. But coming back to contacts, quite a few people will say, well, I don't fancy that, I'll go for contacts. But I learned an extraordinary fact about contacts and how they're damaging the planet.
Yeah, so a couple of things with contact lenses. Contact lenses, first of all, are microplastic. They're essentially pieces of microplastic joined together with water. One of the areas of research, Optical Express is big on research. We've published, as Frank mentioned earlier, we've published more peer-reviewed papers collectively through our medical advisory board than any other organisation. Optical Express has an international medical advisory board that I'm on and that fellow colleagues are on, that are really at the forefront of the ophthalmic industry, and we publish on a regular basis our outcomes. We have a medical record system that allows us to capture data, and really use of that data, what we strive through, actually something you taught us, Frank, many years ago, of continuous quality improvement. We really focus on marginal gains. How can we improve what we do tomorrow for the patient tomorrow from how can we learn from the patient today? And really a key element of that is our data and ability to interrogate the data to understand what we can do. With contact lenses, we've done various studies. A couple of key facts on contact lenses. One, the habit of the patient who wears contact lenses, typically we've moved in contact lens world to be daily disposable or monthly disposable, so soft lenses from frequent use lenses. What that means is they're disposed of more. Unfortunately, the habit of disposing does lead to the majority of contact lenses ending up in our oceans and seas, for example, which is damaging. Yeah, 750 million UK, it's over 2 billion and across the world. Contact lenses per year end up in our
Per
oceans.
year, folks.
Yeah.
By the way, are fish eat these things?
Yeah.
So don't have any fish and chips.
Yeah, exactly. And in terms of, I guess another stat, just to put it in perspective, contact lenses against laser eye surgery. We think of our most common laser eye surgery procedure, LASIK, LASIK. With contact lenses, the risk of an eye infection per year of wear is 4 times greater with daily wear contact lenses. And extended wear contact lenses, so that's lenses that the individual would wear overnight, it's 20 times greater per year of wear than what it is with LASIK laser eye surgery. So across a 5-year window, 100 times greater per year of wear, 100 times greater than that 5-year window of getting an eye infection that can be serious or sight-threatening after contact lenses than after laser eye surgery. So the interruption to an athlete's schedule can be significantly greater through contact lens wear than what it can be after laser eye surgery.
So we as coaches, I always think of our job as before and after. The before part is to prevent issues and to make sure that athletes have got the skills that they need when they go out into the arena. The after is learning from the athletes what they've learned from the experience, so that we can help them learn to do things better or differently for the next competition. So coming back to the before, is there anything we should be thinking about in terms of helping our athletes not have problems, to make sure that their eyes remain healthy that little bit longer before they come to a situation where they...
Yeah, totally, 100%. You must can't stress enough, you must encourage that the regular eye examinations take place. You must ensure as a minimum once per year, every athlete has a full thorough eye examination that we can provide Optical Express, that other providers exist out there that can do likewise. We have the advantage of Optical Express. We work with a range of ophthalmologists and we have advanced technologies and diagnostic bases, so we can monitor really what is a 20 to 30 millimeter structure where we break it down and we're measuring it in microns at levels that are fantastically insightful today, that allow us to look at the different layers of the eye and allow us to detect subtle changes actually before they cause symptoms. So in terms of eye care, where we're going is we're really moving into a preventative medicine phase of eye care. We're utilising AI, we're utilising really innovative technologies that allow us to detect, allow us to manage, and allow us to treat patients today, avoiding problems tomorrow.
Well, that's really what I was after, because prevention is preferring in that journey. So I mean, okay, I'm very primitive in these things. Should it be taking eye drops regularly? Let's imagine my youngster coming through.
Yeah.
Is there anything you could be doing to protect eye drops? Is anything we should be eating?
Yeah. So lots of fish oils that has some plastics in it obviously has some benefits as well. So flax seeds can really improve the tear layer. So flaxseed oils, omega oils can really improve the tear layer. It's really important, if we focus on one thing, it's improving that tear layer. The vast majority of the public that we see have an element of dry eye. Whether it's clinical or subclinical, that's a different matter, but they have an element of dry eye. And improving that tear layer makes a huge difference. So improving the diet, making sure there's regular flax seeds, making sure there's regular omegas in what we eat is going to improve the tear layer. It's going to make our eyes better. Regular eye examinations, we can advise on any eye drops, we can prescribe any eye drops, obviously in line with regulatory requirements in your world of what can be taken, what can. So these are certainly factors that need to be considered, but regular healthy eating of fishes, of flax seeds, of omegas is really key.
Well, I'm learning an awful lot today, and I'm hoping my colleagues are out here. Before we're going to open it out to a few questions if you can. But Colin, is there anything else you want to bring out?
Well, I just wanted to get, I think, Stephen, your thoughts on the direction Optical Express in the next 5 years? Where do you see the group going?
Yeah, so in terms of eye care, eye care is really what we do. It's the heart of the business. We use the data which we gather to really drive care. What we are on a journey of is really expanding our eye care services into preventative medicine services that really enable us to care for the patient in a wider way. The optometrist of today is really the private general practitioner of tomorrow, like the pharmacist today is the private general practitioner of tomorrow. We really aim to provide, as you can see from the slide behind, we've got 4 key brands really within our healthcare portfolio that focus on Optical Express being the really dominant player of the 4 brands. ACES provides NHS services here in the UK. Our medical group is a general surgery and wellbeing brand, and Skin is an aesthetics and cosmetic brand. So really we've got a range of healthcare brands within the group that allow us to care for the patient, whether it be an elite athlete, whether it be an up-and-coming athlete, whether it be a member of the general public, whether it be a coach. We provide really care to a wide range of patients on a wide range of fronts.
So I'm guessing that where you see us moving forward, or Optical Express moving forward, is to be supportive of the GP.
Yes.
Definitely.
Yes.
Nobody can
Yes.
replace it.
Yes.
But just to support them.
Yeah, absolutely, 100%.
Okay, so anybody?
Sorry, I had one further. Sorry, Frank.
Sorry.
Can I ask for your thoughts on the future of elite performance and how it could be supported by groups like Optical Express?
Well, just before we broke there, I did suggest that our job in life is to anticipate what excellence will be. And as every good coach knows, we don't plan forwards, we plan backwards from what that will look like. And then once we get to here, we start a journey. In starting that journey, again, if you go back to my opening few words, when I said that the world is changing so fast for us, we're a people business, and we're a technical business as coaches. The technical business, really, you're all good at that, and no question about that. But the truth is, I don't care how good people are with the technical business. If they're not good with the people business, it's not going to work, folks. And so whatever happens going forward, even although there's a huge change going to be in our world of the technical side, we've got to learn, first of all, to be even better at what we're doing now, but to be more adaptive to what that's going to be. So, and again, to remind you what I said this morning, artificial intelligence is not going to go away. I mean, a lot of really powerful coaches worldwide who are like the old-fashioned Luddites. Nothing to do with us. We want to ignore it. Nothing can replace me as the coach. I get that. But you're going to be a different coach going forward. We've got to make our decisions differently. We've got to lead differently. We've got to have different critical thinking. And we've got to be able to manage our data better. But coming back to what is changing, first of all, artificial intelligence. Secondly, as we speak, software and hardware and technology is going up like this. How many of you are actually using patches to measure cortisol or to measure lactate in training? Okay, I'm telling you now, it's there, it's out there. The New Zealand rugby team for over 5 years now in training have been putting patches on to detect the levels of cortisol to find out if they're ready for the next load of training. Now that technology is out there. I don't know about you, but I didn't know anything about it unless somebody told me from New Zealand. And so I think we've got to be on top of that. Do we understand the changes in technology? And finally, and again, this is so important to us folks, you're going to get far more accurate and far more immediate data than we've ever had before. In the interactive sports, you know, you've all seen the little square thing they have in the back of their shirts for the GPS systems and so on. It's picking up if they're getting slower in the course of a game, so that the coach can pull them off because they're not going to be as effective in the game. But now different kinds of chipping is going to be out there, and so you'll find out if an athlete is getting weaker, moving to the left or moving to the right, so you can pull them in or pull them out. Has that got anything to do with us? As I did say this morning, the field event coaches out there. Just imagine if you get the information that currently TV gets, but we don't get. Like what, Frank? I don't know if you watch television when some of the big stations do it, but it will tell you the angle of incidence of the javelin or its speed of release and so on. The coach doesn't get that. The coach is in the stadium and never sees that. And what we're after, and so I'm asking this at World Athletics level, can we please have a program or an app or whatever, particularly for coaches in field events, so they can access this more immediate information, because you guys have dialogue with them, don't you? Field events coaches here, you have a dialogue with them, you speak to them during the event. Now, I'm not a big fan of that, by the way, but it's the reality. We've got to learn to manage that data better. So our world is changing, and wouldn't it be great if we actually could work out at some point in the future if somebody's eyes are not working properly out there,
absolutely.
and it's causing them to make bad decisions.
Yeah, totally. And I think a key factor there is really, you touch on a couple of key points there, Frank. AI is not going away. It's not going to replace the coach. It's not going to replace the...
And it's not always accurate.
It's not always accurate. It's absolutely not. You've got to really use it to your advantage. You've got to use it, consider how is it going to add to the level of care and your ability to deliver that A1 prestige performance. And we do that in eyes similar to what you're talking about in coaches. I guess for us, data is really paramount. It's really important that we monitor, we track. We've got tracking systems in place that allow us to share with the coach. For example, when we work with professional clubs, we work with some professional sports clubs, work with them, we give the doctors a range of data on their players so that they've got that data available to them, if that makes sense. So we kind of work closely with coaches. Really, your role is paramount really in the development of your athlete. It's important that we, as the eye care professional, as the healthcare professional, educate you upon that person's vision, level of acuity, what their treatment plan is, what their treatment solutions are, so we can work out collectively when is the right time to impact that treatment solution.
And this is exactly why I wanted you guys to be speaking to coaches first. Of course, we can speak to the athletes, but you are the influencers. Remember what I said at the very beginning, athletes make excellence happen, coaches make excellence possible. That's your world. And I wanted you to listen to this kind of stuff because I think it's going to be important to us going forward. Any questions out there, folks? Yes, sir.
Thanks very much for supporting the event today, allowing it to be free for us to attend. I suppose for me, athlete fatigue can be impacted by many different things. The prevalence of new developments amongst our younger athletes, we're seeing more and more visual stress has a big impact on that. It's an area I'm interested to know what your views are and where your organisation's going in terms of that.
Thank you.
Yeah, absolutely. Visual stress is a great area of focus in terms of the industry at this moment in time. It's that there's solutions that are available to help that athlete, to help the individual that we would cater for. So again, it comes back to that routine eye examination. First of all, establishing the issue and presenting the management plan. So for individuals that have visual stress difficulties, there are solutions there that we can provide that really correct through filters, through lenses, that really correct and improve upon the read speed, for example, of athletes, the ability to react. We've got solutions that are possible for that, yeah.
Okay, Brian.
Thank you very much for the presentation of that. I am, this is a passion of mine around general healthcare. I think that the two things that we don't, as a society, focus on is prevention. And the big revolution is going to be in healthcare technology. And in my previous job, I spoke about this quite a lot to try and influence. And I think in this terms of the healthcare tech, because I came out of healthcare tech, the ability, what healthcare technology can do and could do for general health information. But within a coaching environment, because we heard this morning about the need to be able to predict, potential issues, potential injury, potential illness, and AI in healthcare tech, we have to be prepared to adopt that, because I think that's the next revolution in healthcare. There's no question. I'm just backing up what you said.
Yeah, no, I totally agree. I think the technology today is phenomenal. The technology coming in the future years, in the next 2, 3, 4, 5 years, is going to really revolutionise how we can deliver healthcare. working with AI and utilising it is a factor. It's never going to replace the clinician. It's not going to replace the clinician, but it's going to give you that edge. It's going to give you that baseline, not only for the athlete, but also for you as the coach. It's important that you as the coach really have that optimal level of correction in eye healthcare and general healthcare as well, so you can advise the athlete to the best of your ability.
Thank you. Any other questions? No one? Well, listen, fantastic. Colin, Stephen, you're geniuses. Thank you so much. I mean, it's, as I said to you all at the beginning today, I learn something every time I come to these things, and I'm not a young boy anymore. I think this hunger for learning is something that we should all possess. I know also one thing, I didn't say this morning, very often we can come to conferences like this, symposiums, and we can have a question in our head, and the question is, what's the solution? But the only question that should be in your head always is, how many solutions are there? Because the truth is, as we work through our careers with our athletes, one solution will not satisfy all the problems out there. And so, Stephen, thank you so much. I probably didn't mention this, my very good friend David, just a few weeks ago, he was supposed to be here. He had a very serious accident. He's fractured 4 bones and he's damaged his spine. And so, as we speak, he's getting some pretty powerful treatment through. I don't know if you've come across hyperbaric. Hyperbaric chambers. I don't know if any of you have used these things in the past. Well done, Kurt. But you'll get quality confirmation up at the back here from Derek. They are wonderful in accelerating recovery. Yep.
Yeah, absolutely. I lived in one.
Okay.
Yeah, and if we as an organisation can provide any support to anyone in the room, of course you can reach us through Frank. We'd be more than delighted to provide advice, guidance, support in any way we can on an advice basis, no problem whatsoever. Thank you.
Thanks very much.